Welcome, everyone, to the La Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey, and today I'm welcoming into our studio Amy. Amy has been with the center a long time, and I'll let her tell you exactly what she does and when she came to join us. Hi, Amy.
Hi.
So I remember you, you started at the center maybe in the early 2000s or late 90s? I mean, it's been a while, right?
2004?
And you were young, right? How old were you?
26.
26. Oh my gosh. I thought you were 19.
No, not that young.
Not that young. And so Amy was at the front desk. I remember at the front desk and greeting everybody. And you've probably seen, I mean, if it's, like 20 years worth of patients, right?
20 years.
20 years. So tell us what you're doing now and how you help patients from your new or current role.
I do a lot of staff support, really. I do help patients on phone calls here and there. I help patients that need special things like financing things, or sometimes I help with insurance. And I kind of just back up everybody in the office. But my primary is accounts, receiving accounts, paying.
All the fun stuff.
IT support.
Oh, that's right. Amy can fix anything. Really.
Joe of all trades. Yes.
So in terms of your background, what sort of led you to La Jolla Cosmetic?
Honestly, it's my coworker, Kimmy. Her mother worked here years ago and they needed a position and thought I would be a good fit.
I did not know this. I did not know that link. Oh my gosh. And so Kimmy and her mom, and then you, and Kimmy's mom retired, but she's still here. That's so cool. That's so cool. You've had so many years of experience and done so many things. And I think you've seen a lot in terms of, patients and any concerns they have or issues they have, or, kind of, because I think going into cosmetic surgery is a really new thing for a lot of people. They're not used to that world, our world that we're so used to. But what advice would you give to somebody if they're thinking about cosmetic surgery? What would you tell them?
The first thing I tell everybody is it's not as bad as you think it is. It's not going to hurt as bad as you think it is. Everybody has this idea that everything is so painful and recovery is going to be, so hard, and they don't know if they can do it. And I always tell them it's not as bad as you think, I promise you. It's so much easier than everybody thinks it is. There are so many ways now that they can prevent you from being uncomfortable during a recovery. I mean, it's worth it. It's worth it. It's a few days of discomfort and a lifetime of looking better at, wherever you fix yourself.
I think that's a really good point, because sometimes these things seem like, you
Scary.
can, it's scary. And I was just reading, somebody was talking about their procedure and they were like, yeah, I was so excited. I'm ready to go. And then all of a sudden my procedure's next week and I'm terrified. What advice do you have is what she was asking her tribe of people. And I thought that's so true, because sometimes that first hurdle is really hard, of just making the phone call, like having the consultation. And then you kind of go from that apprehension to being excited. But then there is something that can happen, whether it's the morning of surgery or if it's a week before surgery or a few days, where you just go, oh my gosh, what am I doing? And so I know you've had some procedures over the years, and if you want to talk about that and sort of your mindset going into it and then looking back on it.
Well, I had a tummy tuck with Dr. Salazar, and it was amazing. It was amazing. And the worst part of the recovery was slight achiness in your back from leaning forward. And that was it. And the rest of it was, and to have a tight, defined waistline after having kids there's nothing that compares to it. Like it wouldn't even cross my mind to not do it. If I would have known, I would have jumped in there a lot quicker, but it's life-changing. It's life-changing. And I think a lot of procedures that you can do are going to be life-changing. I had my breast done by Dr. Brahmi, and after having kids, gaining weight, losing weight, I got in shape, I started running, all my body fat went away, and so did what I had left of my boobs. And did implants and a lift, and they're high and tight, and there's almost not even words just for how you feel and how your body looks. And I honestly don't know why people don't run in here and do it, especially after doing it myself.
Yeah. Yeah.
Next.
Well, next. Oh, yeah. Where are you? What's on your wish list, Amy?
Facelift.
Facelift. Okay. And how can I ask how old you are?
47.
Okay, 47. All right. So, yeah, so that was something that I think addressing the facial laxity, you can do so much with fillers nowadays, but they stop working at a point and they can start to look pretty unnatural. And if you have extra skin, you have extra skin. And so sometimes it's like, okay, at what point do I say, all right, let me just make the jump? Kind of like what you did with your breasts and your tummy, where it's like, okay. And then once you do it, you're good for a long time.
Long time.
Yeah. So I'm coming up on 20 years since my facelift. And now I'm like, okay, I could do some things again. But it's been 20
You still look great. Like
thank you.
Get this laxity.
Yeah. It just, but you start to have a little extra whatever. but honestly, like I'm so glad I did it. And I did it early. I was 37, not 47.
I think that's a good idea.
But
because you're fixing everything before it gets really bad.
Yeah. And then I've enjoyed it this whole time, and I haven't had to do a huge amount of maintenance. So I think kind of thinking about that and having it maybe in your 10-year plan.
And nobody would have any clue looking at you. Like there's nothing that gives away that you've had anything done. You just look young. And I think that's great.
Well, and I think that though, that's part of doing it earlier. Because if you wait till you have a whole bunch of extra lax skin and you have a whole bunch of wrinkles,
then you have skin issues. On top of it, they make it tight, but then you still have kind of skin that doesn't look very good. Like you need to have a laser or something to resurface.
Right.
We can fix it, but I mean, I think it's helpful to do it a little bit younger.
Well, and it's just a less severe change, like my friends all thought I was nuts at the time, but
I don't think you're nuts. You were smart.
Well, it all worked out, but I think that's I like your kind of like thinking ahead and knowing how much of a difference your mommy makeover over 2 different sessions with 2 different surgeons, but how much that's made a
life
change.
Life changing.
And in terms of like, what would you say is sort of the biggest bonus, like in the way that you're enjoying your new body?
I guess one thing could be that I'll never have to do a sit-up in my life. And I'll look like I do them every day.
Very nice.
I mean, I don't even think my waistline was this great before kids. Like this is probably the best I've ever looked. And at my age, it's time. It's time to live my life. And how better to live it than with my tight little tummy and my big perky self.
Yeah. Well, and you look so good. And how tall are you? Like 5'9", 8"?
No, I'm about 5'7". I'm just shy of 5'7".
Oh, everybody's tall in my world because I'm so short. But like your proportions are perfect. And I think that is a wonderful thing where it's like you just look terrific. And
thank you.
I would think like the confidence level has got to be, something that, that's
huge.
Something that I've found. And I think a lot of our patients, we hear that kind of echoed over and over again is how much confidence and that what you said, why didn't I do it earlier?
Oh no. I tell you what, I can go to the beach now in a bathing suit and walk near the water in a bikini and not feel self-conscious at all. Like at all anymore. And whereas I don't think I've ever been able to do that even before kids.
Yeah, I think it's easy for people to sort of be like, no, you look great the way you are and
Mhm.
you don't need that. But you know what? At the end of the day, it's how if you feel like you want to do it for you,
Mhm.
do it for you. You shouldn't do it for anybody else. But I think
I
if
think a lot of
that's
people look great the way they are, but this is an enhancement. It doesn't take away how you look. It just makes a part of you look a little bit better. So I mean, yeah, like you said, it's whatever bothers you. Why not? Why not fix it
Mhm.
if you can? Why not? Mm.
So tell us a little bit about you. Like, where did you grow up?
I grew up in Hawaii as a Navy brat. My Navy father loved it there so much that he would just restation from one base to the next. So we were in Barbers Point, and then we moved up to Pearl Harbor, and we just kind of bumped around a few times as he restationed, and I stayed there my whole life. And I actually, after seeing all of my friends jump off the island and find new places to live, I finally got persuaded to come to San Diego by my best girlfriend at the time.
Oh, I was wondering, yeah,
Hmm.
how you got from there to
Oh,
here.
with a suitcase in a box and a friend to stay with for 3 months.
Oh my gosh. So, like when you're outside the office, what are your m- what are your most fun things to do on a weekend? Or if you were telling somebody who is visiting for the first time, like, here's what you need to do when you come to San Diego.
Oh, I mean, there are spots to go to that are nice to see. Seaport Village and Coronado. I mean, you can't come here and not enjoy the beach.
Yeah.
It's what we're
Yeah.
about. So Carlsbad Beach is a favorite. Coronado Beach is very beautiful too.
Yeah,
And
I
we
was recently down there and I kind of forgot how pretty it was.
mm,
You don't get over
mhm,
across the bridge all that often. I'm like, this is so cute.
mhm.
So now,
But
how old are your girls?
15 and 6 and 17.
Oh my gosh, time flies.
I
So,
know.
yeah, so you don't even have to worry about the little ones anymore.
Well,
They're
I don't have to
now
cook for them anymore, although they still like when I do. They're good girls. They are
that's
acing it through school and setting themselves up, and I'm super proud.
oh, that's so
Yeah.
cool. You're a good mom. You're a good mom.
Thanks.
So, okay, anything else about, like sort of the experience with surgery or after surgery?
I would just tell people not to overthink it. Don't overthink
Mm,
it. Don't believe everything that people tell you because people don't really know unless they've done it themselves.
that
And a lot of
is
people are going to
true.
be like, "Ooh, that's so scary," and "Oh, that's going to really hurt," and "Oh."
Yeah.
And as long as you have a good place and a good surgeon and good people that take care of you, good nurses. I mean, this is what we are. And I did do feminine rejuvenation the whole 9 yards
Oh,
with Dr.
did you?
Brahmi. And
Oh,
let me tell you, this little secret procedure that so many women want. Can't even tell you. It,
wow.
it
And
reversed childbirth, let me tell you.
yeah, restored the canal, I take
Oh,
it.
yes. The
So
whole 9 yards.
so you did the vaginoplasty, did you do the labiaplasty also?
I did that and I did
That
the perineal plasty.
oh, per per per
Per-
perineoplasty? I don't know.
where they
It's like,
they they redo the episiotomy, basically.
ah, gotcha.
And
Yeah.
after 2 episiotomies with the doctor that just snipped them with what seemed like a pair of pliers, let me tell you, aesthetically, I'm back to normal.
Oh, how nice. And,
Mhm.
like, I would think that's gotta be talk about life-changing, like,
Mhm.
truly having, that whole area restored at the same
Mhm.
time. That's amazing. So did you do that at the same time
With
with
the
the
breasts.
breasts?
Mhm.
Okay, okay.
Mhm. And
And
piece of
how
cake.
is oh, yeah, I was gonna say, how was
It's a piece of
recovery?
cake.
Oh, okay.
They describe it as it feels like you're holding a weight
Mm.
down there. I think I would describe it more as it's pressure. And it's pressure and it's for a couple of days and I found that just kind of tightening everything up every time I had to get up and walk around because that's the only time you felt the pressure is when you got off your bed or couch to go use the bathroom or get some crackers or
Uh-huh, uh-huh.
But that's when you felt it. And I found that if you just kind of tightened everything up,
yeah, suck it in and
it disappeared.
do a kegel
it
while you're
disappeared.
getting out of bed.
Exactly. But if you did that initially getting up, it kind of just, it would wear off. You wouldn't even feel it anymore. And it only lasted a day or two. So, I mean,
Easy.
piece of cake.
Easy. I
Easy
love that.
peasy.
I love that. And we'll put in the show notes because we had Dr. Brahmi come on and we talked about the vaginoplasty. We've had Dr. Breister. She comes on. She does a lot of labiaplasty. And we've talked about sort of the feminine rejuvenation and how much of a difference it can make for people.
Huge.
But nobody really talks about it yet.
No.
So I'm glad we're having the conversation because it really can be, as if, I ended up having C-sections, which is hard, but it's also
you're so lucky.
nothing got messed up down below. But, for people who did vaginal birth and have kind of,
it stretches everything out. And then you stretch out and then you shrink back up, but then everything that stretched out still kind of hanging in there. So
right.
Trust me, wearing pants that were a little fitted, super uncomfortable up the seam, which was a huge reason I wanted to do it. That and some other side effects of the vaginal canal stretching and shrinking back just had weird things, and all the weirdness went. It all went away. He literally reversed my vaginal childbirths.
Wow, that's amazing. That's
yeah.
And I remember when he got trained in that. And when he started offering that, and I was like, that's genius.
Yes.
This is I didn't know this was the thing. And this was, I don't know, this was like in what, 2000?
There are a lot of women that call in
or something.
And when I get their calls, they're lucky because they're getting the one person that's like right on board with you 100%. And I can tell them about it. But there are actually so many women that want it just for comfort levels, just for the comfort of it. Everything fits better. You can wear a pair of fitted pants and it's not going to feel funny.
Right.
And, they want to be intimate with their significant other. And man, to not have stretched out, it feels good. I myself had been in a new relationship. I was divorced and was dating, and I was so proud to be intimate after I had that done with him.
Oh, that's so cool. Because then you're feeling better about yourself and presenting yourself, but you're also probably having a better experience because it's more pleasurable, right?
Exactly.
So, and for everybody, for him probably too. So yeah, when Dr. Brahmi, it was interesting because, he started doing this like 20 years ago and it's become a big part of his practice. He said, about 30% of his practice is feminine rejuvenation. And so
a lot of women want it. They just don't say anything because it's not something we talk about out loud, Well,
I'm glad we're talking about it because a lot of people might not even know that it's something that can be fixed.
I mean, and it helps with so many things. Like it brings the muscle wall back together, which helps with, urination issues that some people might have. Just, it helps with everything.
Wow.
I
love that. No, that was fun. I didn't know we were going to take a turn down that road, but I'm glad we did. I'm so glad we did because I think, and that is good to know for people who, if you're listening now or watching us on YouTube, know that Amy is a resource. She's not one of the patient coordinators who might see you after a consultation, but she's right there in the back office. She can talk to you. And it's nice that you're open about talking about it.
Absolutely. I don't mind. Well, I have no filter. I'll talk about anything.
Well, it's, and I think it is normal. All of this is normal. And if it's something that you have and it bothers you, that's normal. That's okay. And doing it for you and then knowing that, there's other people who've done it also and are willing to share their story. And so, Amy, thank you so much for coming on. Anytime. I really appreciate it. And so if you're listening today, check the show notes. We'll have links to everything we talked about. And be sure to check out on our website, we have a specials and events page. So you can go there, you can see what specials we have going on, because we have, like right now in May, we have a mommy makeover savings, which could be all the things. It could be breast, it could be tummy, it could be vaginal, it could be some combination. And then we also have on-demand replays of our webinars. So you can see what webinars are coming up. So I just wanted to bring that out to everybody and let you know. So thanks again, Amy, and we will see you all on the next one.
All right, thanks, Monique. Bye.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to LJCSC.com or follow the team on Instagram at LJCSC. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.